All right, so I wanted to get on here and make a quick video because I just posted some short form content on my Instagram, pretty much about the concept of how there's no job security within healthcare. And now I know everybody's going to say, oh, there's a shortage in nursing, there's a shortage in healthcare, there's always overtime, you can always, I get it. But when I'm talking about job security, I mean having control over your income, which we don't have because guess what? You don't sign your paychecks. And I can only say this from experience because over the last 6 years, I went from being a staff nurse to being an agency nurse to being a travel nurse. And now I'm a nurse entrepreneur trying to create a stream of income for myself. But let me kind of explain what I mean. I said it once and I'll say it again. Working in healthcare is a high risk, low reward job. There's so many risks when it comes to working in healthcare, whether that's getting sick from a patient, getting assaulted by a patient, giving the wrong medications and having a med error, or the biggest risk of them all, you killing somebody. And no, I don't mean you actually murdering someone. I feel like if you worked in the ED or the ICU, we've all had those patients that when we come into our shift, they're doing just fine, they're stable, but by the end of our shift, they ain't. And with working in healthcare, everything that we do to get inside the door, to get our licenses, it's about getting the answer right. Now, everybody knows about testing in nursing school. All the answers could be right, but which one is the rightest? I think that's how you say it. You guys know what I'm saying. The select all that applies and all of that stuff. Yeah, that's what they've trained us to program our mind to understand from day one. Like, you have to get the right answer or there's a liability that somebody could be at harm. And it's like, as a nurse, you have so many things going on. You're managing your patients, you're administering medication, you're doing your documentation. There's so many things that you have to juggle, that you have to monitor and keep track of, that there's so much room for error. And guess what? We're humans. Just because you're a nurse does not mean you have to be perfect. But because we work in healthcare, people's lives are at risk and there's so much liability to the institution, you can't up. And if you do up, even if for 20 years you are a perfect nurse, if they feel like you are now a liability to the institution, to the bottom line, you're out of there. And take it from me, I know I've been fired before. Now let's say you don't want to be a part of the institution. You want some autonomy, you want some flexibility and freedom. So you go out, you become an agency nurse or you become a travel nurse. Now guess what? You may be getting paid more, but there's still no more security than if you were staff, because now that you're contracted, there's less security because now you're not even a part of the institutional umbrella, you're a contractor. So they can get rid of you way faster without having to go through the institutional steps and guidelines before actually terminating you. As a travel nurse, I've seen nurses get their contract cut before they started, in the middle of it, and before they ended. I've also experienced myself starting a contract at a certain hourly rate, and during that contract, my rate being cut or decreased without me having any say-so. The only say-so you really have is to say whether you're going to accept that rate decrease or end your contract and take your ass home. And it was during the pandemic where I realized how valuable we as healthcare are, because now all of a sudden during the pandemic, they mysteriously find money to pay us what we're worth. I mentioned it before. At the height of COVID, I was making upwards of $160 an hour. Pre-COVID, I wasn't even scratching 50, and I was doing the same work, just maybe at a higher volume. And then when the pandemic ended, that 160 I was making, it seemed like it was dropping every week. And like I said, there was really nothing I could do about it. So they could pretty much terminate you when they want to. You can't make any mistakes, and then they can change how much they feel like paying you when they feel like it's necessary. And I hate when they say,
oh, well, the market is this and we're just trying to match the market.
So just last week you was able to pay me $95. Now this week you got to pay me $85. The market don't change that much. And honestly, guys, over the last 6 years, I feel like I've seen it all, done it all, and worked at 100 hospitals. But what I've noticed is from facility to facility, from contract to contract, nothing changes. Nothing changes. At the end of the day, we are just a number. We are just employees, or if you really want to get deep, we just pawns on the chessboard. Now, I will say, working in healthcare does provide job stability. You know, there's always hours you can work. You know, there's always overtime you can pick up. Working as a nurse is a great career, and it can provide you with a financial foundation to use as a launch pad to get into something else. But when it comes to job security, job security does not exist within the hospital. The real job security lies within inside of you. It's in your skills, your mindset, your network, and your investments. So if I can get you guys to take anything away from this video, make sure you guys are taking the necessary actions to put yourselves in the best financial position for the future. Because if you think you're going to rely on a hospital or a staffing agency, oh, you're sadly mistaken. So if you enjoyed this video, please make sure you share, like, comment, subscribe, tell a friend to tell a friend, and like I always say, keep tapping in. See you when I see you.